shall not come to the hospital and we say you have office syndrome, but it is something that when you see the signs and symptoms, it can trigger to look at how you're living your life and probably come for treatment. Yeah, that's basically what it is.
Perfect. So you said it is an umbrella under the musculoskeletal symptoms, the diseases.
Yes.
So what is that umbrella?
Yes, now the umbrella, the umbrella, I talked about umbrella because many of the things that happen in the body are under it. Probably, let's say, the pains, the numbness. So you find someone is having a series of things that are happening with their body, but they are not actually knowing the cause of it. So when you talk about the umbrella, it means it is masking so many things that one should actually first seek medical attention to identify a particular diagnosis.
Why are you concerned on the office syndrome as an orthopedic clinic officer?
Yes, that's a very good, important issue to discuss about, because that should highlight the prevalence that comes with such a syndrome. Statistically, when you look at people who are in office duty, now I'm talking about office duty, I don't want to mean people that are at work only, but even at home, when you have that time with your laptop, with your screen, and you're seated there, it matters how much it's being affecting you. You know, we do work, but it should not cost our health. So when you talk about the prevalence, in 10 of people, if you could say a sample space of 10 office workers, 8 out of those present with office syndrome. Why? They have posture that is not really good. The distance they're having towards their screen is really short. They're having a strain. They're having a lot of body discomfort, positioning as well, not taking breaks. So all those things are very much concerns. And when you come to the hospital, we have time to talk to you and probably share with you some of these things as preventive measures to avoid even progression of some diseases. Mr. Kedi.
Excellent. Thank you so much. I was humbly listening into this very important statistic. And of course, we said that not only persons who own offices.
Yes, please.
So who are those people who are at a risk
Yes.
of getting the office syndrome?
Yes.
Because we want to say, because my mother is a farmer, will she get the office syndrome? We want to explore what are those major risk factors. And each risk factor, just broaden it up so that our viewers can fully learn what it means.
Yes, thank you so much, Mr. Kedi. Now, I think I'll actually have to elaborate this more because I want to create that connection between the public and what we are speaking. Because we said office syndrome doesn't mean someone who is only in office. It means someone that actually takes a lot of their time during the day in one position. Probably, let's talk about people who work in the bank, okay? The bank tellers. They're usually standing behind the desk, they're serving. So that could be a person that is at risk of having office syndrome. Talking about people who are administrators, people who are HR, AR, such kind of people. We talk about receptionists as well. They also have such kinds of environments that usually predispose them to such risk factors. Then we also talk about students. Now, this one, I think probably someone will be like, but how am I really affected? The study time that you have in front of that desk, the time that you're having maybe on that laptop that you're using or the phone that you're using can also affect how much your body is going to be costed.
Which type of students are you looking at?
I'm talking about people who are probably maybe campusers, people who have those, even people in high school, you know, they have probably a paper tomorrow, so they take in like 8 hours of consecutive reading. So they are seated and they are concentrating on the material that they're having to take up.
Now, I want us to understand this before we go to other risk factors.
Yes, please.
So if I am able to sit for 5 hours in a day without moving around, or maybe 2-3 hours, what's the maximum threshold time of sitting? Can I qualify to be among the office syndromic people?
Okay, yes. I think the ideal is that every 30 minutes, break the cycle of rest. I think you once hosted I think not even hosted, but there's someone that I had that brought out the statement of sitting is the new smoking.
Yes, I hosted him here.
Yeah, that must have been
a physiotherapist actually.
Yes, please. So you have to break the cycle. So every 30 minutes you have to break. So I won't say that 6 hours is a maximum, But if you look at yourself and you're not having the breaks in between your positioning, then you actually at risk of having office syndrome.
I was about to talk about now sleeping, because we sleep. Let's drive to the next risk factor.
Yes, yes, yes.
But what I wanted to talk about the schools is that the area schools, we used to do PE every morning.
True,
I don't know where you studied your primary, but here in the town setting, you realize that our children, actually, there are no playgrounds. The schools are just constructed in...
Yeah, that is true. The setting of the place.
Yes.
Yeah.
Please go ahead to the next.
Of course, I was talking about the student life. I don't want to relate it so much to them, but in terms of the time they spend in front of that study time, like the computer, the books, the positioning, the chair they are using, in the long run, it can really catch up with them. And we have those many cases of students, teenagers coming to us presenting with such symptoms. But more to that, we have drivers. Now there you'll be asking me, this is something that is moving, but I talked about the time and how much you take to actually do that activity. Okay, so if you don't have breaks in between and you're doing something for a very long time without rest, you are at a risk of having the office syndrome.
Perfect. So you're trying to say that people who drive should stop and then exercise and continue the journey?
Yeah, you can probably stop the car, get out, go to the supermarket, buy something, come back. Just try to break the cycle, and it helps you to adjust to even more better postures that you actually did not have before that are good for your health.
Excellent. Thank you so much, Benjamin. I usually call you Benji. And of course, want to thank you for bringing your expertise to Google Data Vision. Yeah. Now, my main concern is, you told us why you are concerned as an orthopedic officer, but I want us to relate this to the modern world.
Yes.
Why in Uganda now are you receiving, you said in 10 people you have how many?
Like 8.
Like
out of
8,
those,
yes,
like
who present with such symptoms.
Yes.
I wanted to ask, why is the percentage going higher? Like in Uganda, yet we're an agricultural country and we expect people to be more informed.
True. Thank you so much, Mr. KD. Now, I want to mention that not only in the country Uganda, but globally, we are now in a fast-paced kind of development. Everything that has come up is trying to simplify life, simplify work. So what happens is that when you look at, let's say, some workplaces, they have put in place technology and devices that are there to quicken work. So what happens is that the body has to adjust to that kind of setting. So let's take an example of a computer and a keyboard in front of you, okay? That keyboard has to be at a certain distance from you. Okay, the monitor screen has to be at a certain distance from you. The desk has to be at a certain height. The seats that we have to use have to be ergonomic seats. So there's a way how...
What's ergonomic seats?
Yes, an ergonomic seat is one that is adjusted to suit the body of someone. Having a lumbar support, having armrests, having adjustable height size, like a lot of things, even the support of the head, it is suitable for office duty. So we find that now people are trying to improvise, or some of them are less advantaged to have some of these resources. So it costs the body. And that's why the burden keeps growing with time. You find that you try to relate what is causing the problem, and you can only tailor it to their workplace. So that is why the growing burden has come so much often. And that's why we, at OrthoPulse, as we said, we shall insist on educating the patients to know what is exactly supposed to be done, how they're supposed to do it, and what are the outcomes that are supposed to come out of that.
Excellent. I'm so excited because I'm a good student, actually. I didn't tell you this. So I am good at listening.
Yeah.
And of course, there is some word you said that it's a combination of psychological factors. So
Sure.
Does this mean that being an office, you know, we have different bosses? So how does stress contribute to the office syndrome?
Yes, thank you so much, Mr. KD, once again. Our dear listeners, I want to elaborate more on that because when you look at office syndrome, it's hard to talk about office syndrome and eliminate talking about work ergonomics. We had a detailed conversation about that, I think, on one of our platforms. But it's basically the workplace itself being suitable for you so that it doesn't cost your health. So I want to mention something called environmental conditions, and these are basically things that you do not engage directly with on your workstation, but they are around you and actually have to affect your body. So some of them we have like heat, noise, all those things can contribute to psychological discomfort. Okay, so in the long run, they pile up. So someone presents to the hospital, they have what we call, for example, there's what we have like cervicogenic headaches. Now, those are headaches that originate from the cervical spine, but then they move upwards to the base of the skull. Okay.
How do they come about?
They come about especially when you are stooping forward on that desk. Probably you're trying to reach that screen and it's very close to you, so you stoop your head or you bend forward. So the pain that usually arises from the neck causes that pain that actually moves up to cause the cervicogenic headaches. Okay, that is also something that is under office syndrome.
Wow.
Yeah.
So let's break down the office syndrome now into the local conditions that we understand.
Yes, please.
Please go ahead.
Yeah, now I think that will also bring to now what is masked by office syndrome.
Please
because
do.
as I said, it's not a diagnosis, it is an umbrella term.
Please
so
do.
we have the common one. I'll begin with the common ones. Mechanical back pain. Okay, this one usually comes with the wear and tear, the degenerative condition that usually happens when patients or like people, their lifestyle is not suitable, so they develop things like spondylosis, lumbar spondylosis.
What is that?
Lumbar spondylosis is more like a degenerative spine disease whereby you find there is wear and tear of the spine bones. Okay, then we have.
So how does that present so that the viewer can understand this?
Yeah. Now that one usually presents with severe pain that usually occurs in the lower back. Okay, and also sometimes it comes with some aggressiveness of activity. Probably you work a lot, or maybe you stand on your stairs, or maybe when you're seated, when you want to stand, it causes aggravated symptoms of pain. Sometimes it could be involved with numbness as well in that particular area. Okay, so that is all under the mechanical back pain.
Okay.
But it also has that bit of lumbar straightening, that you find the back of someone is straight, losing the lordotic curve, which is usually supposed to be the normal.
Perfect.
Yeah.
You can go the next.
Okay, let me go to the next one. So we have carpal tunnel syndrome. Okay, now carpal tunnel syndrome, we're talking about repetitive use injuries, which usually come due to failure to take breaks in something that you're doing. For example, I'll take a very, very common example of the factory workers that we have. These people who do sorting of items, okay? So usually what happens is that there is circulation that is impeded, and then you find that there is also inflammation in that area. So it causes pressure in that particular area that compresses the nerves.
Okay.
So the nerves will start being impinged, and then it will cause numbness, tingling in probably the fingers, and that's a diagnosable condition, carpal tunnel syndrome.
So which workers are at risk of getting
Exactly.
carpal tunnel
Now
syndrome?
the common ones I talked about, factory workers. I can also talk about border men, because border men usually there's vibration that comes. Vibration is a risk factor in repetitive use injuries. Vibration that comes around the joint. So when that vibration is too much, even construct workers, it causes inflammation and swelling that impedes the nerves. I can also talk about people who, office workers, who don't have cushioned pads on the keyboards that they are using. There has to be a pad that cushions the pressure point to the joint that you have. So to also help out on the cause of the symptoms that come by that.
Perfect. Thank you so much. I am fully learning a lot, and your information is really on point.
Thank you so much.
Next point.
Yeah. So another point that we can have as a condition as well, we can have neck pain. Now, there's what we call text neck syndrome.
Text neck
Syndrome. Now, this is a very broad aspect of neck pain that even goes beyond office to even people that are consuming our devices, probably on a phone, and you're having that stooping posture of looking at your phone without rest. So you have pain in the neck. And what happens? We have cervical spondylosis. That is also wear and tear of the cervical spine. Okay, so that is also something that can also cause some referred symptoms of neurological deficit and also pain in the hands. You find someone cannot lift, they have weak muscles. All those can happen in cervical spondylosis that is actually caused by that risk factor.
So us who are social media addicts, we are at a risk of getting
yes, though you're out of office, but still.
So it can still follow you.
Yes, please.
What other conditions?
Yeah. Now, also I can also mention about the ones that I talked about, the ones which are usually common. Okay, but now we look at things that are actually now beyond like manageable stages of conservative. We can have deformities of the spine. Okay, now there I'm talking about things like kyphosis, lordosis, scoliosis. Those ones usually come in the long term of failure to manage, or failure to be having to have a health-seeking behavior when such symptoms start arising. Okay, so you find someone, because they don't have the right posture at their workplace, they don't take breaks, they have poor ergonomic settings and equipment. They find themselves having such positions, and then in the end of it all, they get into a deformity state.
Excellent. Thank you so much, Doctor, for the wonderful revelation. And of course, for dear viewers who just joined us, we are speaking about office syndrome, and we are trying to demystify many classification of conditions that are masked or mimicked under this very syndrome. And now we take a short quick break, but when we return, we want to discuss more on how to prevent this, and if unattended to, what could happen to you or to my health. See you shortly.
Good Day TV, transforming your life. Tosubwa ku Good Day TV.
Classroom esingira ddala obulungi is the outside classroom. Teri classroom esinga real life.
Omulimu gwenfunye si eddoketi y'emu gye ndi mu kusoma.
Ebintu bye tusomye tekikukakatako nti bwe mansomye mawulire bw'obanga olaba togenda ku Good Day TV tolowooza nti ate ensi ekomye.
Engeri ebintu gye bikyusemu tebigenda tutabulatabula.
Bwe banga bakyasomesa omwana wo ngeri gye baakusomesa emyaka 10 oba 2 emabega, there is a fundamental problem.
Omulowo wa Good Day TV tosubwa olw'omukaaga luno essaawa 2 ez'akawungeezi ne Monday essaawa 2 ez'okumakya.
Amasomero gye bayise abazadde be tuyiseemu si bonna nti bagenda tegeera ebintu ebifa mu nsi.
Nga tuli wamu ne Concer Businge, kitunzi wa Victoria University, ng'akunnyonnyola ensonga zino butya bw'osobola okuzikwasaganya.
Kiri about a things you can do. What can you do? Kiki osobola okukola kyekigenda okuweesa omulimu.
Tosubwa ku Good Day TV.
Life is a race, not against others, but for a purpose greater than yourself. Every step you take matters. Every decision you make can change the course of someone else's journey. At Makere Full Gospel Church, we are running a race too. A race to purchase land next to the church compound so as to expand our parking space and build more infrastructure for God's work. With your purchase of Run Your Race book, authored by our very own Pastor Fred Wantanti, for just 30,000 Ugandan shillings, you're not just buying a book, you're joining the race. All proceeds from the book sale will go toward purchasing the land. Together, we can build a legacy that will last for generations. Buy your copy today and let's run the race together.
Good Day TV, transforming your life.
Once once again, I want to thank you for watching Good at Your Vision. You're most welcome from a short, quick break. In such breaks, actually, we encourage you to walk around because we've just been saying that you should not sit for more than 30 minutes. Rather, you should be walking around, sip a glass of water, and of course, promote self-care. All these practices are meant to promote self-care and, of course, encourage healthy lifestyle. And of course, I'm still having Mugabe Benjamin. He's an expert and is trying to demystify complexities around office syndrome. And we're not only looking at the people who have offices, but we have people who own actually stores, shops, all these. You sit for a long time. Even if you are breastfeeding, you should not breastfeed for 4 hours. I mean, you have to stand up and walk around for 30 minutes so that you exercise your body, so that you avoid the office syndrome that has different conditions under it. Now, I want to talk about posture. Before you go into other things, posture is very important. How does posture contribute to the office syndrome?
Yes, thank you so much, KD.
And what is the correct posture, or should a person sit for different age groups?
True. Thank you so much, Mr. KD. Our dear listeners, thank you for keeping us up with the conversation, and you hinted something very, very important there. Now, I want to begin with one statement, that the best posture is the next posture.
The next posture
is the best posture.
Okay.
So if I'm seated like this, the best posture for myself is how I'm going to be seated the next second or the next minute, the next posture. That brings in the factor of movement. But that one was just to try to highlight how posture and movement have to go together. But talking about posture that you mentioned, our dear listeners, we need to know that the posture that is ideal for our health is usually supposed to relate with the equipment that we use, okay? So someone could want to impose a right posture, but with the wrong equipment, it's very hard to get that posture, Mr. KD. So the posture that I would actually talk about in an office setting, okay, is making sure that when you're seated in that chair, you are in contact, your back is in contact with the lumbar support. Why? Because there is some bit of load that is transmitted to that lumbar support that puts off weight the spine, okay, which helps to relieve pressure, okay? Talking about the arms, these armrests are there for a reason. They're there to help us to rest these arms, but also make sure that we are comfortable in what we are reaching, okay? We talk about the feet. The feet should be flat on the surface. You should not have feet that are inclined or that are sloping. They should be flat on the surface. Then
just hold on. Way back we used to have seats where your legs would be swinging.
Exactly. Now the biomechanics of the body are going to be against that. You'll find that some bits of you are outweighed and some are overweight. So it can bring about mechanical tension in the body.
Okay.
Yes. So when you put the feet on the ground and they are parallel with your thighs, that is the right posture to possess. So means
my posture is bad.
No. No. I should have mentioned that if it was. But you should make sure that the height of the seat is also important to make sure that the feet are flat on the ground. So if the seat is so low, then you'll be forced to stretch out your legs. But if the seat is ideal, your legs will be inclined at the right angle. Okay. Then I also want to mention about the table that you're using. The table also has a lot to do with the posture that you impose. Why? If that table is very, very high, it means you'll strain the head more up because you want to reach whatever is on that table. And if it is too low, it will make you to lean forward and leave space, which I talked about in the beginning, to have the lumbar support. Okay? So all those are components of posture, and they are very, very important as a risk factor as well.
Very important points. But I want us now to talk about the means of transport that we use.
Okay.
Sometimes you sit in a bus like Link.
Yeah.
I think you've used Link
it's
once.
everyone's favorite, I know.
Yes. Now, sometimes you find like maybe the new models are best and the others are. So how can transport officers or managers make sure that the seating is upright to what the standard is.
Yes, the standard is. Now there, we are talking about transport.
But have you realized the dilemma in transport?
Yeah,
means?
it is there. And actually, I want to first talk about the cushion which people sit, because there is a condition we call coccydynia or tailbone pain that usually comes at that coccyx bone that is at the end of the spine, whereby it gets impinged, or like it has a pain that is sharp. Why? Because people sit on hard surfaces. So there are some transport means where you find the seats are not cushioned, okay? So there is a lot of pressure between the seat and themselves. So that's supposed to be done. Then also we have to talk about the back support. I think that would be something very important. We have to have back support in those seats.
And most buses have lost these.
Yeah, the armrests.
The armrests.
They have also been lost. So you find that people have issues like myofascial pain syndrome because the shoulder is always at work, not at rest. Where it's supposed to rest, it's at working, even when you're not doing something. So that is also something that it should be looked at. We also have the neck support. The neck support usually is an attachment to the back support, but it helps to rest the neck. So when you're not doing anything, you're traveling, you're going maybe safari, or maybe you're going home, at some point in time, you can rest that head to relieve pressure on the cervical spine. Okay, so those are all components that I think these people of the transportation should look at in order to have the things comfortable for the travelers.
Perfect conversation. Yeah. And of course, I want to thank you, Mr. Benjamin. Your expertise cannot be taken for granted. We'd rather actually want to thank you. So I want us to once again talk about other dilemmas related to our sitting postures and in relation to the office syndrome. What are the dilemmas from experience? Using experience now. What have you observed?
Yeah, true. There are very many conditions, I should say. But I want to talk about those that usually are, for starters, that usually have the early set on, okay? The ones I mentioned already, they are there, but then we can also talk about tendinitis. Now, tendinitis, this is inflammation of the tendons, okay? Tendons that are not bone, but they're also soft tissue that usually have that connection around the joints, okay? So when we have tendinitis, this is basically inflammation, so inflammatory condition that affects the tendons and usually presents with pain, limited range of motion, inability to do some things around the joints, okay? So it could be on the wrist, it could be in the elbow, all those places can be affected by tendinitis, and it's also masked by office syndrome. Okay, so you begin feeling these kind of symptoms like numbness, pain at a particular area, but then you do not know the cause of it, not until you come to the hospital and we tell you that actually work is costing your health. Another point that I have to mention is myofascial pain syndrome. Okay, now this one is basically affecting this behind part of the shoulder. There are some muscles that are usually insert and originate at the back side of the shoulder, but they're also having effect on them in terms of like the pain. So they have such kind of failure to raise the shoulder. They cannot stand back. They cannot really reach something that is above them. That is also a condition that is diagnosable in the hospital. Okay, I talked about cervicogenic headaches. I think you remember that. That is also, it's more on the neurological bit of things, but it can also be something that can be diagnosed, masked under office syndrome, whereby the pain is originating from the cervical spine to the base of the skull.
Thank you so much, Mr. Benji. I want to just talk about the issue of the age groups.
Yes.
Which age group often presents with the office syndrome?
Exactly. Yes, that would be good. I think it just skipped my mind, but it is very important because even when the patient comes to the hospital, you know, in orthopedics, we have what we call age-related conditions, the ones that are degenerative. We have congenital conditions, the ones that are at birth, okay? Then we have those that are work-related, okay? So when you see the patient coming in, you have to know their age because it's going to help you to derive to the cause of their problem. So most of the patients that present with office syndrome are the middle-aged one. Those ones that are in between 20, probably beginning that life of independency, having to do something for a living, and then you reach like probably like 40, 35, okay? So that kind of age group usually is very active, they are determined in life, so they don't even have to look down on what they do, okay? So that is the kind of age group that is affected by office syndrome. But most of those don't know this information, and that's why we're here today to speak about it, Mr. KD.
Perfect, perfect. And of course, I want to just rate something to weight gain. Do you think weight gain at a certain point? Me as a nutritionist,
Yes,
I'm very
please.
concerned.
Yeah.
Because I believe that orthopedics move together with the nutrition
True.
at one point.
That's very
And
true.
I'm looking now at obese persons together with these related to office syndrome.
Yes, please.
How can they be related together? Or in your experience,
Yes.
have you observed that weight contributes to such?
Yes. Now, I'm going to mention something. I'm not going to attack you in any way, Mr. KD, but weight is very much relatable to office syndrome. Why? There are patients who are too big to occupy the seats that they have. Okay? So you find they're in a workplace, they are doing what they're doing, but the seat they are having is too small for them. Okay? Because they are big. Okay? So such a person will have obviously be affected by work, because it will cause a lot of tension, discomfort, all those things. But looking at weight as an independent thing, in terms of nutrition, I think not only office syndrome, we advise weight to be in the ideal. The BMI should be really an ideal, because the weight of the body that is transmitted down from the head to the feet usually is the same that is usually transmitted in that spine. Okay, so look at a stick and it is being weighed on by like 80 kilograms. It will be too much compared to a stick which is having 40 kilograms. Okay, so of course sometimes it's hard to attack patients like that when they've come for a consultation to talk about their weight, but usually we recommend nutritional advice, and that's where you come in, Mr. KD.
Perfect conversations. For our viewers, want to thank you for watching Good Data Vision. I actually want to encourage you to go on social media platforms, Good Data Vision, LinkedIn, Facebook, Twitter, TikTok, so that you can share in your opinions and be part of this valid conversation. Remember, we are trying to create a conducive atmosphere for self-care for you so that you can go and start immediately. Remember, here we do not mention drugs, we just mention the things that you can adjust from your home, the things that you can do immediately from this talk show without actually seeing a health worker. Remember, self-care, these are things that are done by an individual in the presence or the absence of a health worker. That means this is typically what you're doing as recommended by the Ministry of Health Uganda. Now, Mr. Benji, we want to call upon policymakers. We want to begin with a policy, with the table people. You know, people sit on the table.
Yes, yes.
You know them? We want to rally them.
Yes, yes.
What should they prioritize, especially the Ministry of Health officials, when it comes to health worker-related office syndrome? What should they prioritize with? And should they develop a guideline for office syndrome? Should they develop a guideline for people who sit for a long time? What should they do in relation to this very topic?
Yes, thank you so much, Mr. KD. I think we are now getting to the bottom of this. But talking about the policymakers, I would want to start with the Ministry of Work, okay? Because that one is the one that usually canopies everything that relates to office duty, any form of manual and physical labor work that is there. So we need to have standards in workplaces. Okay, I know usually we have tried to improvise as much as we can, but the ideal usually sets the baseline. Okay, so I want to implore the Ministry of Works and Transport to have these guidelines, especially in workplaces like hospitals, let's say even banks, those that usually have the people that I mentioned, the ones that are at risk, okay, so that they have their bodies not costed. Now, for example, ergonomic setups are really, really important. And by that I mean an ergonomic chair, an ergonomic desk, and even a computer that is portable and ideal for someone that is using it. Then talking about Ministry of Health, I think we need more of patient education, Mr. KD. I really, really adore how much you have really educated. You've really set the nutrition landscape on another scale, and I feel that also needs to be happening in this field of ours for orthopedics, the patient education. Many people do not know this, because I think I sometimes face patients and they say, really, I wish I knew. And probably some of them, they're like, at our workplace, it's not there. Can you please write for me a recommendation? And probably I tell the resource team to look and probably have them procured. So meaning there is that gap, okay, in terms of the patients or the people knowing the ideal and also moving away from what is not helping their health. So we call upon Ministry of Health as well to help so much in the place, to reach out to different people, okay, having these advocacy initiatives to help people know the truth about work ergonomics. Yes, then also I think Google Day TV is a very, very good TV that has really set the example out there when it comes to preventive care. And I know that many others should really implore this as well, to spread the news of preventive health about such an issue.
Perfect. Thank you so much. And when you read the policymakers, we don't want to leave the people we've been speaking to.
Yes.
We want to enforce something. So I want you to speak like as an expert, enforcing something to the viewers regarding the office syndrome and why they should see it as an urgent matter to give attention to immediately from Monday.
Yes, definitely, because that's the working day. Okay. Yes. Now, thank you so much, Mr. Kedi. What I have to say about office syndrome on the back of what we have discussed today is that it is preventable. 90% of what we have mentioned about office syndrome is highly preventable. And I think this speaks more when you come to us that on top of giving you medication, we have to add the patient education, because we know if we give you medication and you don't follow these tips, one, the progression of the disease will continue. Number two, if you get well, with time you'll have a relapse of the same condition. So it is very important to have the prevention. And why do I say this? Because we at OrthoPulse, we believe that we have to shift from reactive treatment to proactive prevention so that someone owns their health fully. Okay, so I want us to talk about the prevention. Number one, the workplace ergonomics. Okay, we had a very detailed conversation about that, but still I implore the public and all of you to really focus on having ideal equipment in your workplaces. This seat is just there to protect you, because there is no way you shall sit or shall make yourself comfortable in an equipment that is not ideal. So I implore to have the ergonomic seats, ergonomic chairs, the ergonomic tables in place. Number two, posture is very important. I talked about the tips, the ego tips of posture, how you're supposed to posture yourself. I know we are not robots, okay? But the body has created a mechanism whereby if it is not fine, it will communicate with pain. So whenever your body communicates with pain, get to know that's the least signal it can give you to know that you have to adjust your posture. Number three, we have movement. Now, movement is medicine, Mr. Kedi. Mm-hmm. Yes, it is medicine. I think the physiotherapists love that so much, because for them they deal with mobility, making you sure that you function, exercise.
Whereas
okay?
now when it comes to my side, I say, please, your mouth.
Yeah, please, your mouth. You understand? But please, we encourage you to do movement. By that I mean switch stations. I know some of you have fixed static positions of work, but you can switch a station. So if you've been sitting probably on that desk and you're typing, probably you've seated for like 1 hour, wake up from that seat or get up and move, maybe to a printer. That movement that you would have made is very important for your life that you do not know. So also, we have to take breaks. Breaks, I say the ideal is every 30 to 60 minutes, change position. And that brings back to the issue of the best posture is your next posture. So you have to have that movement in you.
Excellent.
Okay? Yes, Mr.
I don't want us to leave without talking to employers.
Yes.
Because this is more related to workplace. Remember, we have different employers and how they take this information serious. Because of recent, we're launching guidelines to workplace eating, you know, because of the foods they supply the workplaces. But now you are bringing in an issue of the office syndrome. That means once again want to remind employers, because you understand that 75% of your time is spent at the workplace.
True,
And
that's
only
true.
25% while you're traveling, like 10%, and 15% in your home. So please write the employers so that they can take care of us while we serve them.
Yes, yes. Thank you so much. I think you have a very good claim there, Mr. Kedi. Yes, the employers, please. I would want to really seek that you think about your workers, because Mr. Kedi, I've had very many people come and they're asking for sick leave. They're asking for a sick leave because they don't feel in the best shape to work. Okay, but this is now a deficit to the company or to the workplace.
And
so
they tell you, add me 3 days.
yeah, add me 3 days. Some of them even want a month or so. So it is very, very important for the employers to look, before you have that setting of maybe the work or the office, make sure you have the right equipment. And when you have it, make sure these people know how to use this equipment. It's very important. So Mr. Kedi, I was winding up on the preventive measures. I want to talk about weight management. Now, I don't want to talk
Just
about...
in 2 seconds.
Yes, in 2 seconds. Okay, weight management is really, really important. Then also, the last thing is sleep. Sleep is recovery, Mr. Kedi. We have to make sure that when you rest on the right equipment, the right position, and wake up well and ready for the next work. So it's going to help the recovery process for the next day. So thank you so much, Mr. Kedi, for this
Perfect.
opportunity.
Thank you so much, Mr. Benji, for the wonderful information. I don't know if you love the name Benji that I give to you, but of course I want to appreciate the fact that you've been with us since we started this important program at 8 p.m. But of course we want to say that this information is typically reaching out to you from Google Data Vision here at McAfee Gospel Church. It's up Rokagwa Road, and those traffic lights, you're welcome to home. And of course, we want you to go and start implementing these things immediately. Do not wait, do not look right or left, just implement them as soon as possible. Give us your last message.
Yes, thank you so much, Mr. Kedi, for once again this opportunity. It's really an honor once again to be in this space. So, as we said, our dear listeners, office syndrome is not something to take lightly. It may begin slowly, but it grows, and the burden usually is costly more than you think, from conservative treatment to even surgical advanced measures. So I implore you all to seek this information and also take it in as advice that's going to help you. Once again, shift from proactive treatment to reactive prevention. Thank you so much, Mr. Kedi.
Do you have any greetings
Yeah, greetings to
your girlfriend?
No, not really. Probably I'll send my greetings and shout out to one of my inspirational figures. That's Dr. Nyombi, spine consultant surgeon, and also many others, even you, Kedi, by the way, I don't want to mention, even if you're in the space here. But thank you so much, and I would ask that if you want to listen to more of this education, you can reach us out on our platforms, OrthoPulse Wellness Hub. We have very many channels and media streams that we shall be able to feed you all this information. Thank you so much, Mr. Kedi.
Perfect. Thank you so much for watching Google Data Vision. We want to thank you for being here with us since we started this important program. Once again, we're every single Wednesday at 9 p.m. And of course, we stream live from McAfee Gospel Church, just here at Saprokagwa Road, and we bring to you these programs that have experts that have studied, that have experience, but also that are willing to give you tips for your wellness and self-care information. I am Kamara Daniel. Up to you next week, Wednesday, and I love you so much. See you. Hi, this is Health and Beauty Program every Wednesday 8 to 9 p.m. at Google Day Television. And of course, with me, Kamara Daniel. This program informs you so that you can prevent yourself from getting the health conditions, diseases that are prevalent here in Uganda. Remember that 75% of the health conditions here in Uganda, they are preventable. On this very important program, we bring to you gynecologists, the doctors that have specialized in women health, the doctors for children, our babies, the pediatricians, the advocates like the sickle cell champion, among others. Every Wednesday, 8-9 p.m. with me, Kamara Daniel. Be there on Google Day Television.